Hi, I'm Heidi Eve-Cahoon. I'm a breast care navigator at Akron City Hospital Summa Health System, and I'm going to show you today how to do self-breast exam. The first thing you're going to want to do is look at yourself in the mirror. Can you pick your breasts out of a lineup? You should be able to. So look at your breasts in the mirror. Stand in a relaxed position. Look from the front, look from the side. Raise your arms over your head. Put your hands on your hips and squeeze. And then lean forward and let your breasts fall away from your body. What do they look like? You should not see puckering, dimpling, redness, swelling, any discharge from the nipple. The next thing you're going to do is lie down. When you lie down to do the breast exam, roll onto your hip and put your shoulders back with a pillow underneath. I'm going to be doing my right breast, so I would be on my left hip and rolled back. And then I will take my right hand and put it on my forehead. This makes it stretchier than if I put my arm behind my head. Then you're going to examine the breast area. Not most of us look like this breast. Most of us aren't a nice little hemisphere taped to our breast. We all have different shapes, some big, some small. So we're going to do a pattern that goes from the bra line to the collarbone and from the breastbone to under the armpit. So kind of like the seam on your shirt to where the buttons are, from your bra line up to your collarbone. That's all breast area. It has breast tissue and it has lymph nodes. They all need to be checked. The pattern we're going to use is a stripe method. We're going to start in the armpit and examine down, take a step over, examine up, take a step over, examine down, come over. So zigzag across the breast. That way you won't miss any breast tissue. Another thing we're going to do is use 3 fingers. Remember the Scout pledge? This is the breast exam pledge. I will check my breasts. You use these 3 fingers, these 3 finger pads, not the tips, the pads. And you're going to put your fingers down and do 3 small circles like you're going around a dime. You're going to do the 3 small circles in different depths. First on the surface, then deeper, and then deepest. You might even be able to feel your ribs. So surface, middle, deep. And then you'll take a step over, slide your fingers, surface, middle, deep. Surface, middle, deep. So here I go. I'm in my position. I would start back here, surface, middle, deep, step, slide, surface, middle, deep, step, slide, surface, middle, deep, step, slide. And what am I feeling? I'm feeling a sack of tapioca. Some people have more tapioca than pudding, and some people have more pudding than tapioca. But if you have a tumor in there or something that doesn't belong, it's going to feel like you have a stone in there or a frozen pea or a rubber eraser. Something funny is going to pop out. You're using flat hands, so you're not digging around, just flat hands on that big sack of tapioca. So here we go again, starting in here, surface, middle, deep, step, slide, surface, middle, deep, step, slide, surface, middle, deep, step, slide. And now I'm at my bra line. I take a step over, surface, middle, deep, step, slide. The leading finger always takes a step. And then I'll come across, and now I'm on my little model. So surface, middle, deep, step, slide. Surface, middle, deep, step, slide. When you get to the nipple, feel under the nipple. Is there something under there? About 60% or 50% of tumors are in this part of the breast. About 18% are under the nipple. So you do want to feel under the nipple. You don't have to squeeze the nipple. You don't have to squeeze the areola. You may get some fluid if you do squeeze, and that's perfectly normal. Surface, middle, deep. When you get to the nipple, you can roll flat on your back and continue. Surface, middle, deep, step, slide. Surface, middle, deep, step, slide. Surface, middle, deep, step, slide. Step over. Surface, middle, deep, step, slide. And continue on with your breast exam. When you're in this position, the breast moves evenly across the chest wall. If you lie on your back, most people's breast kind of hangs off into their armpit, so you have a lot of tissue to feel through. When you're in this position, it stretches out, it's thinner, and it's against your rib cage, so it's easier to feel. Once you've gotten this part of the breast done, it's fine to lie flat and do the inside part of the breast. Take a step, and you continue. That's all there is to it. Try and do it once a month if you can, right after your period if you're still menstruating. And if you do notice a change, feel a change, it's time to bring it up with your physician. Don't forget your mammograms, and I give you the salute of the self-breast exam woman. So long.